Hi, my name is Fatima Zara, and I'll be exploring cultural safety in relation to Indigenous health. What is the significance of cultural safety in contemporary nursing practice? Cultural safety is a term that refers to an individual's understanding of respect, empowerment, support, and identity in order to advocate for the rights of other individuals. It is a framework that nurses, midwives, and other health professionals use to identify power imbalances between the health team and the recipients of care. The purpose of cultural safety is to protect the values, beliefs, and practices which are associated with any culture. It encourages and promotes the practice of customs and traditions by increasing cultural awareness within the workplace and areas of sensitivity when providing care. Why is cultural safety a problem related to patient safety and maintaining a healthy workplace? According to the ABS study in 2015, ischemic heart disease remains to be one of the leading causes of death within Aboriginal and Torres Strait Islander populations. That is 1.8 times the rate of non-Indigenous Australians. The main reasons for these high rates is due to trauma that these individuals may have previously faced with their experiences in healthcare. The clinical environment did not cater to the patient's personal cultural values, and so they often felt distressed during hospitalization. Walsh and Corey further state the potential reasons to be poor health literacy, disengagement with family during decision-making processes, inadequate cultural competence of health professionals, multiple patient transfers, and favoring management of patients based on assumptions that there are increased comorbidities in Indigenous populations. In terms of Aboriginal health workers and the effect that cultural safety has, it is often found that the role of Aboriginal and Torres Strait Islander health workers is blurred due to the diverse scope of practice and services which are undertaken. Thus, these health professionals have an increased likelihood of facing personal, ethical, and cultural dilemmas whilst working as a healthcare worker. This can gradually lead to less support and high chance of early burnout. Aboriginal and Torres Strait Islander workers should be actively appreciated for their work as they are the first pivotal point of contact with local Indigenous communities and are the first mode of access to existing specialized services. What is being done about cultural safety? The Congress of Aboriginal and Torres Strait Islander Nurses and Midwives provides a pathway of practice that encourages communication, the use of dialogue, power sharing, negotiation, and acknowledgement of white privilege. The application of these techniques will act as a form of comfort and acceptance towards all of the experiences individuals may have faced. Moreover, the association states that in certain clinical interactions where issues of power equity between patient and health professionals are prevalent, cultural safety promotes the establishment of a genuine partnership. This professional relationship ensures that the power is shared by both parties involved in the decision-making process. What is being done about cultural safety? According to the Closing the Gap 2019 report, the Australian government is working towards creating policy to provide culturally appropriate primary care by funding more than 160 organisations, inclusive of 130 Aboriginal community health services, through the Indigenous Australians Health Program. In addition to this, the Australian government is planning on ensuring health services are also focused on trauma-informed healthcare for Aboriginal and Torres Strait Islander people, increasing cultural competence of health professionals, alongside the development of the Indigenous health workforce. Prior to the release of the Closing the Gap 2018 report, the Nursing and Midwifery Board of Australia had reviewed and added principles of cultural safety in the Code of Conduct for Nurses. The code addressed the behaviours that are expected of nurses along with the standards patients will expect when being cared for. Nurses are to engage with patients in a safe and respectful manner to foster an open professional relationship. Leadership in nursing. Leadership is a characteristic that is necessary across all nursing domains. The term is defined as the action of guiding others, individuals, teams, or entire organizations by introducing and teaching others about new or previously mentioned topics. New graduate nurses must apply and exert these skills as they progress from an enthusiastic student to a competent professional clinician. All new graduate nurses are emerging nursing leaders that are learning to adjust and self-reflect on current practice to understand the areas in health which require advocacy. Nurses should develop visions through innovative new methods that can be used to teach future nurses. These programs will engage and mentor novice nurses during their early years so that they understand the existing frameworks and are part of a work culture that is diverse and empowers all individuals. What clinical strategies can new graduate nurses employ in relation to cultural safety? In terms of working with Indigenous health workers, the National Aboriginal and Torres Strait Islander Health Workers Association has a cultural safety framework, which is an initiative that encourages new graduate nurses to break down barriers to respond and empower fellow Indigenous healthcare workers. The association has deemed that leadership plays a significant role in embedding aspects of cultural safety within the work environment. It has also identified strategies which new graduate nurses can employ to manage and maintain a clinical setting that promotes cultural safety when working with fellow Aboriginal and Torres Strait Islander healthcare workers. It recognizes the need for balanced understanding of Indigenous culture when referring to academic and/or clinical expertise. It suggests the importance of being aware of the diverse non-verbal and verbal communication styles that are used by individuals. We are also expected to respect the cultural obligations of others without having to seek validation or question their own beliefs, in line with the cultural protocol. These techniques are universally applicable to all individuals that practice a diverse range of cultures. In addition to this, it is important to remember that certain methods may work with one community, however, might not be as effective with others. And so, personal tailored engagement is needed. In terms of patients, there are certain strategies that can be actioned to increase Indigenous patient health outcomes. The first would be to establish a transfer system that is designed to reduce delays and number of transfers experienced by the patient. This in turn will comfort the patient so they are not overwhelmed by the stages and effort required to reach the intervention. The patient may wish for a family member to accompany them throughout their journey, which in response the nurse should organize one family member to be escorted as per the patient's wishes. As registered nurses, we have to be responsible to commence patient education using educational tools that are accessible and are culturally appropriate, so that both the patient and their family are well informed about all procedures and length of stay. Similarly, the new graduate nurse is responsible for considering the involvement of an Aboriginal liaison officer and an interpreter when developing a plan that works in conjunction with the patient and their family. The purpose of the Aboriginal liaison officer is to provide all of the patients and parties involved with emotional, social, and cultural support. Support utilized seeks to understand the feelings of fear, isolation, and homesickness which an Indigenous individual may feel. New graduate scope of practice in terms of legal and ethical boundaries. New graduate nurses should not only rely on course accreditation for knowledge on safety and cultural safety, but we must be aware of the measures that are readily in place. These mechanisms are the standards that govern clinical professionalism and quality. The Nursing and Midwifery Board Code of Conduct states specifically about cultural safety and its link to respectful relationships in Principle 3. In Section 3.1, it acknowledges that Aboriginal and Torres Strait Islander people were the first to inhabit and shape Australia with its diverse culture. It mentions that new graduate nurses and all nurses must apply holistic care that is free of racism, challenges assumption of belief, advocates and facilitates for Indigenous Australians to gain access to culturally safe health services. It also recognizes the importance of collaborating and partnerships and forming partnerships in the health decision-making process. In reference to Section 3.2, the Code explores culturally safe practice when interacting or caring for patients that have different cultures or different beliefs. It ensures that nurses respect individuals with diverse values, gender identities, and previous experiences. The practice also applies to interactions with fellow team members. On a similar note, the Code embraces a positive work culture through supporting the rights and dignity of others, inclusive of colleagues and family members. Nurses must also identify that it is the recipient and/or the family members which decide if the care provided is culturally safe. Thank you for listening to my presentation.